Welcome to Healthcare Forward, where industry leaders, benefit advisors, and healthcare professionals come together and discuss the changing landscape of commercial health plans. Brought to you by Roundstone Insurance, the first group captive for health insurance, where smarter self-funding meets long-term savings. I'm Mike Schroeder, founder and president of Roundstone Insurance. Welcome, everybody. We have another great podcast here at Roundstone's headquarters in Rocky River, Ohio, Healthcare Forward, and I have a really special guest from Boston, Alex Anderson of Color Health. And so welcome, Alex. Glad you made the trip.
Thank you. Thanks for having me.
Well, as we were talking earlier, we're going to be talking about cancer. But let's just start. It's not going to all be bad, right?
Yeah. There doesn't have to be all doom and gloom.
Good.
There is hope.
So what is it about cancer that is such a challenge for health plans and for people in general? I mean, why is it so tough?
Well, I think if you look at the state of the disease and where it's trending in the U.S., it used to be an aging person's disease, right? It primarily affected old people. And obviously recent data shows, and the American Cancer Society puts out a report every year quantifying the impact, but it's trending younger. So it's affecting a wider swath of the working population. The cost to treat, like everything else here, is increasing. So it's becoming very, very cost prohibitive. And furthermore, there's just incredible fragmentation in the U.S. healthcare system, creating healthcare inequities, disparities. Individuals are not up to date on their cancer screenings. There's low primary care adherence. I could go on and on and on. But the reality is that the byline is that cancer is trending younger and it's affecting more and more of the working population.
And when we talk about cancer, there's a lot of different cancers.
Yeah.
So in our conversation today, are there certain types of cancers we're really focusing in on or that Color Health pays close attention to?
Yeah. So color in and of itself focuses on guidelines concordant cancer screenings and the cancer types for which there are guidelines established. We are an ASCO certified organization, and so clinical rigor and clinical integrity is sort of in the bones of Color Health, really relying on published data, efficacy, and guidelines to inform our approach. So we primarily focus on the 5 screenable cancer types, which are prostate cancer, colorectal cancer, cervical cancer, breast cancer, and lung cancer, which amass, majority of the cancer diagnoses that we see in the U.S. today.
Great. Now, there's a lot of screenings that go on today, and the outcomes still aren't what we want them to be.
Yeah.
What's different about what Color Health does? How are you just kind of changing the approach other than just the routine screenings you might get from your primary care?
Yeah, it's so interesting. So, top level impact. Color's supported over 7 million patients nationally. 23% of individuals that enroll in Color are due for 1 or more screenings. So round numbers, let's call that 1 in 4 individuals. We're identifying individuals that, sure, may be due for a mammogram, but we're also identifying underlying risks. So we work to understand an individual's family history of cancer and other risk factors at a very granular level. And this is all baked into the guidelines established for each cancer type. But the question then remains, okay, so if you have guidelines and guidelines demonstrate risk, why are folks not getting screened? Well, those guidelines are hundreds and hundreds of pages per cancer type. So I myself am a perfect example of this, and I'll share a personal story. I enrolled in Color 2 years ago when I joined the company, and I went through a guidelines concordant cancer specialized risk assessment. I took it on the web, but I could have done it telephonically live with a clinician. Based on my family history of cancer, I was found to be at elevated risk of breast cancer at 38 years old. So I had not aged into traditional mammogram requirements. I wasn't yet 40. I always like to share, I live in Boston, as you mentioned. I have a PCP. I have an OBGYN. I see them both annually.
Right.
I'm healthcare informed. I'm healthcare compliant. And yet neither one had ever recommended to me that I met guidelines criteria for a mammogram based on my family history of cancer. And so that's where sort of the rubber meets the road. We've overburdened primary care. We have huge accessibility challenges in the US, right? Healthcare deserts, healthcare disparities, and even when someone makes it to their primary care or annual wellness visit, primary care docs are responsible for my family planning, my behavioral health needs, everything, right? And so there's not a specialty area for cancer. And so oftentimes those risk categories are overlooked, which brings me back to sort of my overarching response to your question, which is why aren't folks getting screened? Folks just fall through the cracks at every step of the cancer care journey.
All right, so let's talk about early detection.
Yeah.
Obviously, that is a game changer.
Yeah.
That is the objective, and that's what we want to try to encourage.
Sure.
And why is it so important? Why is the early detection? I mean, like, what is the impact when you find something early?
The impact is huge, both on survival rates, but also on total cost of care. And I think for any risk-bearing entity, any self-funded entity or entity that bears risk for the health of a population, early detection is the single largest lever that you have to mitigate the costs of cancer. Why? Because it is far more cost-effective to treat in stage 1 or 2 when it's detected versus stage 3 or stage 4. And we're talking a difference of like 5 to 6x total cost of care per national averages. In comparison, the survival rates are also demonstrably different too, right? So if you're detecting lung cancer at stage 1, you have a 63% chance of survival rate in comparison to stage 4 lung cancer, where you have a 9% chance of survival rate. I like to point out lung cancer because, it's not like we have widely established guidelines to address the pervasive use of vaping in the US and the like, right? We're still guidelines aligned to 20-pack a day smoking use and traditional tobacco and cigarette use. But only 6% of individuals in the US who meet guidelines criteria for a lung cancer screening, which is a low-dose lung CT scan, are up to date on their lung cancer screenings. 94% of individuals in the US who should be screened for lung cancer are not screened.
Wow. So as a health plan sponsor, it's a good idea to have some strategy to encourage early detection.
Yeah.
Obviously, as a company who pays a lot of healthcare claims, we're always looking for ways to save money on the cost of care.
Yeah.
And I do know that Color Health delivers that in several different ways.
Sure.
I mean, one thing that caught my eyes is just simply in the early detection in terms of testing in labs and things. The utilization and the steerage can deliver some cost savings.
For sure. We focus on proactive, timely interventions spanning the full cancer care continuum, from early detection, again, where you have a very large lever to pull, but also when you're detecting an abnormality, the clinical management following that abnormality, as well as through treatment, and on the backside, mitigating the risks of cancer reoccurrence and survivorship. But one thing that we do really, really well is in a given population of 20,000 individuals, 50,000 individuals, 100,000 individuals, we pinpoint those that are at elevated risk for cancer and mitigate the risks against those late-stage diagnoses. And it is a very controlled effort throughout the full cancer care continuum to reduce those high-cost claim impacts through things like site of care optimization, formulary alignment, proper med management, tumor board review, identifying misdiagnoses, treatment plan review, ensuring that if there are guidelines established for treatment for a particular cancer type, that the local oncologist or the treating oncologist is aware of those guidelines. I can't begin to share the number of patient cases where Color has intervened on behalf of a patient in conjunction with a patient to do a review of the patient's care plan and has identified a misdiagnosis which then was a miss or an incorrect treatment plan.
Wow.
And intervening before those high cost claims happen is also the way in which you can reduce the cost of care.
Which this is related to, I noticed, and this was new to me, was the amount of savings just in the emergency room experiences, both in terms of the visits to the emergency room and the reduction of those, as well as being admitted and the reduction of admissions from emergency room visits. And so that your care kind of helps with that. Can you share like how that works? Because that's a big dollar amount right there.
For sure. So ER and ED utilization is one thing that, organizations consistently always focus on reducing. The reality is that individuals in treatment for cancer experience a whole range of side effects. And by the way, those side effects don't necessarily end when treatment concludes, even when they're in survivorship. 5 years post-treatment, there's a tremendous amount of complications. So Color and Color Medical, Color Medical is comprised of oncologists, survivorship specialized oncologists, and cancer specialized primary care physicians. Intervene with members, proactively checking in on symptoms that we know are likely to occur. And this is more than just, hey, are you experiencing nausea as a result of, your chemotherapy starting today? Mm-hmm. Don't get me wrong, that's all well and good, but side effects are also attributed to co-occurring conditions. That's one of the things that is most overlooked is cancer is oftentimes a co-occurring condition. The primary condition may be type 2 diabetes or rheumatoid arthritis, with cancer being the secondary. And so it's important to treat the whole person and look at all of the medications that they're on and address fall risks as a result of neuropathy, which is a side effect of treatment, nerve pain, lymphedema, ensuring the proper PT referrals. So there's so much more to cancer than just, I think, the traditional chemotherapy and radiation that folks think of.
You mentioned survivorship.
Yeah.
Can we talk a little bit about what that is? And, it's funny, when I was looking at that, I never even really gave that thought. Makes common sense now that you bring it up, but what is that all about?
Yeah. So this, I think, if I start to sound really passionate about this, it's because I think it's the single largest growing area of impact for organizations like us who focus on cancer. So in a given population, you will have 8 to 10 times more cancer survivors than you will those with an active diagnosis who are in treatment. And here's, just the reality of survivorship. When you conclude treatment, oftentimes, you ring the bell. You traditionally stop seeing your oncologist. You go back to being managed by primary care, which is best case scenario. Studies show an overwhelming number of cancer survivors have not been seen by a primary care physician within 5 years of concluding treatment. And survivors are at elevated risk for cancer reoccurrence. So the cancer type they were previously diagnosed with coming back. When it comes back the second time, it oftentimes comes back more aggressive. So it's likely to be detected in stage 3 or 4. They're also at elevated risk for developing new cancer types. So Color developed a survivorship center of excellence. I'll call it that. We, as mentioned, employ survivorship specialized oncologists. Yes, that is like a subspecialty that exists. And those survivorship oncologists develop a care plan for an individual that spans 5 years post-treatment, and it outlines all of the things that they need to do specific to guidelines to manage against that risk. That includes things like cancer screenings, colorectal cancer screenings, cervical cancer screenings, PET scans, bone density scans, all of those, true outline of the things that are needed to mitigate the risk of reoccurrence. But we don't just, hand the plan over to the member and say, best of luck. We coordinate those referrals on their behalf, and we help them get reestablished with primary care. We share the care plan with their primary care team to make sure that their primary care doc is up to speed on their survivorship recommendations. And this is not a specialty area, going back to primary care. This is not a specialty area of primary care, right? Primary care is inundated with managing whole person health. They can't be cancer specialized and survivorship specialized and manage everything else that they're supposed to. So, in terms of the financial impact, we're preventing over $175,000 per cancer reoccurrence avoided. And that is through proactive interventions, managing against that risk of reoccurrence every step of the way.
Right. You've mentioned the dollar savings a few times. Color actually has an ROI guarantee. Is that accurate?
We do.
Yeah.
We are, I like to say we're the only benefit solution that offers an ROI guarantee. We service a tremendous amount of self-funded groups, but we very much put our money where our mouth is. We have very palatable performance guarantees, and we see really, really high engagement. So in a given population, we'll see, and this spans multiple industries, right? Retail, manufacturing, aeronautical defense industries, commercial airlines, grocery store companies, you name it. Anywhere from 10 all the way up to 44% enrollment and engagement in a given population.
Wow.
So capturing a wide swath of the population into our funnel, which is how we sustain our results ultimately.
So let's talk about how you engage with the health plan. My understanding is the TPA, in the case of Roundstone, like our TPA would be Bywater.
Yeah.
We share our data with you
Yep.
on the groups, and from that's how you'd identify the high risk members, or
Sort of.
is that?
So if we go back to my personal example, my claims history, nowhere in my claims history was there a marker to say Alexandra's at elevated risk for breast cancer? Because like my family history of cancer isn't captured on my claims record, which is why I completely flew under the radar for my health plan and my TPA, right? I was 38. I wasn't yet 40, so I never appeared on a care gap list that I, had a gap in care related to a mammogram. So Color's engagement approach is to outreach to all individuals who are over 18 years of age. The very first question we ask when they enroll is, can we help you understand your risk for cancer? Or do you have cancer right now? Or have you concluded treatment for cancer? Or are you providing caregiver services for someone diagnosed with cancer? If you selected any one of those options, that would spit you into a care pathway. But if you selected the first option, I want to better understand my risk for cancer, we're going to take you through that cancer risk assessment. And that's where we identify underlying risk that health plans are unaware of because it doesn't show up in claims history. A good example of this is like occupational risk, right? Firefighters are at elevated risk for lung cancer due to repeated carcinogen exposure. And again, back to my personal story, that risk didn't appear on my claims record. So that's why we're able to see such high engagement, but also furthermore, tying back to that stat of 23% of all enrollees being due for one or more cancer screenings. It's because we take an individualized understanding to understanding someone's risk of cancer.
So as an employer, I listen to this podcast, hopefully, and I say, boy, it's really from early detection, ongoing care and, care management, and then survivorship. How do I make sure my plan has access to Color Health? I know with Bywater, it's in our plan document.
Yeah.
So if you're a Bywater customer, you have access to Color. So do you engage with every one of those employers in some fashion, or you do just kind of wait until you have an issue to deal with?
Great question. So we are a benefit solution and we work with all of the different constituents in the healthcare ecosystem. So we work with payers, we work with pharmacy benefit managers, we work with TPAs, we work with self-funded employers directly who can contract direct with us if we don't have a relationship with their payer or their TPA or their PBM yet. We support labor and union groups. We work with public sector entities. We really span the full ecosystem of risk-bearing entities.
It's really an encouraging message because, and we talked earlier to today, and I was sharing, a lot of people just think it's like a bad lottery to win.
Yeah.
That cancer is something you hope you don't get, but
Exactly.
there's really nothing you can do.
Yeah.
And so it's actually very encouraging that early detection, that there's a strategy for it.
Totally.
And I mean, I keep coming back to it, but it's a game changer with early detection.
You're absolutely right. It's the lottery that no one wants to win. And like you're thrust into being a participant in, but you never wanted to enter the game. You never wanted to have a ticket, right? But it is about understanding your own awareness. And like I sit here and I remain shocked every single day that I've worked in healthcare for decades. Like I said, I'm healthcare informed, I'm healthcare compliant, and yet I was one of those people that was at elevated risk. So now I know that information, and sure, it's actionable for me. And Colors physicians doubled back with my PCP and my OB to make sure that they understood I was at elevated risk for cancer. So they worked to educate my local care team, which was great. But I am a prime example of someone that fell through the cracks. And so I think, selfishly, if this can happen to me, this can happen to anybody.
Yeah, no doubt about that. It was interesting. I recently went to a couple-day physical, and one part was family history.
Yeah.
And I had never realized, I'd given thought to heart disease, and I could kind of readily identify the folks in my family who had heart disease. But as I reflected on cancer, I struggled to remember and identify those that had cancer because I just never really had thought about it.
And even then, it's like, what cancer type?
Right.
And so it's difficult. And imagine that from the lens of a primary care doctor, trying to work through every single one of those family members and capture an updated record. Then by the way, things can change on a yearly basis. You may have had a family member that was diagnosed with cancer in the last 365 days. But if it wasn't discussed in your annual visit, then that's a missed flag of potential risk, right? So it's like, it's not just the understanding of risk at one point in time. You have to be proactively engaging with individuals on a yearly basis, which is what Color does. So we reach back out to every participant yearly to understand, has anything changed in your family history? Because risk is a moving target that we're tracking against.
Let's talk a little bit about how you get paid.
Yeah.
So you start working with a member.
Yep.
It's not an approach where everybody on the plan, whether they're working with you or not, there's not a fee for that. It's more like, okay, we've identified a member, we're engaged with that member. That's how you get paid. Can you share a little bit more about that?
So the construct of like the PMPM and PEPMs, that's dead. Color is utilization-based pricing. It's 100% billed through medical claims, or can be, I should say. We do have some groups that prefer to be invoiced, which is totally fine. But we only bill for services when we render clinical services to a member. So Color provides at-home FDA-approved screenings for some cancer types, colorectal cancer, prostate cancer, cervical cancer screening. And we bill when those screenings are completed, meaning when a result is rendered and returned to a member. And if we're engaging with an individual through early detection, treatment management, or survivorship, we bill a care pathway fee. But every single one of our services is billed via CPT code. So from an administration perspective, flows through your medical claims, you can very easily see the comparison pre-color of your cancer spend and post-color of your cancer spend.
That's fantastic. I also understand now why Roundstone likes you guys so much. We, our philosophy is we want to keep things variable.
Exactly.
We think costs are variable.
Exactly.
We don't like the high fixed costs. I described the other day, I was in a conversation. I said, think of it like cable TV.
Yeah.
Right now you're paying all this money for cable TV, and how many of those channels are you really watching?
Oh, yeah.
Whereas we want to create a health plan in which you only pay when you access the care and the solutions you need. And Color very much fits into that. That's why we really embraced you guys when we bumped into you and made you part of our ecosystem of cost containment.
Well, thank you.
Since it wouldn't be a conversation today if we didn't at least touch on AI.
Yeah.
What is Color doing? As I sit here and reflect on family history, on capturing information, I'm wondering if AI has an opportunity to play a role in what Color is doing today.
For sure, it does. So today, Color has a partnership with OpenAI. And and we use it to support our clinician tooling. So I had touched on the fact that guidelines are complex and guidelines are specified by cancer type, and they're hundreds and hundreds of pages long. It's also worth noting, while we support the cancer types for which there are screening guidelines established in early detection, for individuals who've been diagnosed with cancer, are in treatment currently, or previously diagnosed and are in survivorship, we support all cancer types, even the rarest, every stage. As it relates to that, I think AI has played an important utility in aggregating the most up-to-date guidelines for our clinicians and proactively flagging gaps in care. So an example of this is, an individual was found out via MyChart notification on her cell phone that pathology results were positive for breast cancer. She'd gone in for a routine mammogram and there was a mass detected, and she learned via MyChart that it was breast cancer. She made a flurry of appointments with oncologists all over. She lived in New York City metro area and showed up at a few different oncologists, and each one of them was like, yeah, I'd love to treat you, but you're missing a whole slew of lab work. Like, you probably need a genetic test. We need to understand if this is a result of BRCA1, BRCA2 gene mutation. Like, could be the difference between a lumpectomy versus a double mastectomy, which is scheduling OR time. It's like two completely different types of oncologists, many different types of breast cancer. And that's the reality of cancer today. So when you're diagnosed, no one hands you a playbook that outlines, there's no Microsoft project plan saying, this is step 1, this is step 2, this is step 3, this is step 4, and like you progress. Color takes ownership of that. We leverage AI for clinician tooling to proactively identify those gaps in care at every stage, not just early detection, but certainly treatment management and survivorship, so that individuals don't miss those critical clinical interventions that inform treatment pathways or inform opportunities for reducing risk against cancer reoccurrence. That is the utility of AI today. I think there's a lot of opportunity for advancements using artificial intelligence around patient engagement, participant engagement, developing care plans for participants to review at the snap of their fingers. Mm-hmm. The opportunities are really endless. But in any clinical setting, our philosophy is nothing supersedes clinical judgment. So there always has to be a human in the loop. There always has to be sign-off by a color physician before any intervention is ever presented to a member. We can't lose sight of the importance of the human in the loop and let AI take over everything from a care delivery perspective.
Yeah, I agree with that, but I learned something interesting yesterday about AI and its involvement with care. Is a former hospital administrator has started a business for AI sort of in nurse caregiving, sort of when folks are in a hospital, they're there 24 hours.
Yeah.
How many hours are they actually getting care and seeing somebody? And believe it or not, it's very small. It's like 2 of the 24.
Yeah.
In terms of time. So during their other time there can be AI tools that keep track of what's happening with that patient. And he actually engaged in some conversation. This person has a name for that caregiver, AI caregiver, if you will, called Amy.
Yeah.
But what he shared, which was really intriguing to me, is how open people are with an AI tool about how they're feeling. And I was like, that's shocking to me that someone would speak into an AI Amy and share personal information.
Yeah.
And they said, well, it's because they feel like they're not going to be judged.
Yeah.
And they're not going to be, they're talking to somebody, they don't think anybody's going to form an opinion other than whatever that they're telling them. So it's just amazing to me, all the AI that's getting involved in care nowadays.
For sure. I think we're just trying to be really judicious in our approach to integrating AI, knowing there's a whole universe of opportunity, right? Working with payers as frequently as I do, payers are becoming much more astute at running thoughtful diligence on the utility of AI as it relates to mitigating potential risk. So there has to be proper guardrails. Everything that we have implemented into our solution, even from a clinician tooling perspective, has been validated, researched. We've published the results before it's ever embedded in the product. So we have an element of rigor, which requires a balance on your speed of innovation, right? I think, absent that, we would continue to innovate at the speed of lightning. But we recognize you have to have substantiated evidence to prove that implementing AI is doing what it's supposed to do.
Absolutely, yeah. You're getting
because
return.
Humans' lives are on the line.
Yeah.
So.
Totally agree with you. So we started the conversation. I said, hey, today's conversation, it's going to be about cancer, but it's not going to be all bad. And I hope we delivered on that. I mean, for me, color is really about hope. I mean, as an employer, and we see it all the time, you're hoping that you don't have a cancer hit your plan, but that the reality of it is probably going to happen.
Yeah.
And so what I really like about color is it's peace of mind. You can have it in your plan document. You have a focused strategy when you need it.
Yep.
That strategy is going to save you a lot of money other than just hope and see what happens and throw them into the system without any kind of involvement. So I really think color is a hopeful message. It's not a negative message. And I hope that comes across in this podcast.
A couple themes that I hear quite often is like, well, we have really high member or employee attrition rates. So that cancer diagnosis might be the next employer's problem. But the reality is, like, no one's eradicating cancer out of their population. The employees that are walking in the door, the open recs that you have, like, that's going to be cancer walking in the door. Cancer is always going to be prevalent. And this isn't about, facilitating more screenings to find more cancers. We're not here to increase utilization. If anything, our screenings are way more cost effective than the traditional care pathways. It's about just understanding who's at elevated risk and managing against that risk thoughtfully so that you have some sort of cancer control strategy and a risk mitigation strategy. That's really what it's about.
Well, Alex, I really appreciate you coming today. And I enjoyed the conversation, and I'm very happy that Roundstone's plan has color health involved with it.
We're delighted. Thank you so much. Pleasure.